The primary goal of any law enforcement agency in this country historically has been to enforce law. That's its basic function. And over the last probably, I'd say 50 years, give or take, it's expanded more into social service roles. CIT stands for Crisis Intervention Team. The team actually began at Oklahoma City in 2002, where the department trained an initial group of 100 officers. Now we have a total of 158 trained CIT officers citywide in the patrol functions, and they're spread amongst all the shifts and all the divisions. If it's not something that is called in as, a mental health issue, they make it clear up front. The officer, has to determine that kind of stuff, during the response. And this has actually happened where the responding officer was getting information from somebody calling in about a property theft, and the individual started accusing, somebody from outer space had taken their stuff. Somebody from the public driving by, seeing somebody on the corner talking to themselves, or having a conversation with a utility pole, or things of that nature. And then it can be something like a domestic disturbance that you get out there, and the officer that responds realizes that there might be a mental health component. The overwhelming majority of people that suffer from mental illness are knife-wielding maniacs. They're people that have issues with anxiety, depression, maybe a type of mood disorder, and things like that. Those are the overwhelming majority. They function fine in public. Every once in a while, for some reason, something will trigger a crisis that'll get us involved. But a lot of that stuff is pretty common. It's a lot more common in our society than we want to admit. It's unfortunate that we're in a situation as law enforcement officers, not only here but nationwide, of having to put people in the back of a police car, behind a cage, and take them for mental health treatment. That's horrible, but how else can we do it? The system has to adjust to keep the police out of it as much as possible. That's really the only way you're going to reduce the stigma. Sometimes I have to ask myself, what's it going to take? What's it going to take to get people's attention to this? I don't have the answer.